Let's talk about due dates. A baby is normal, healthy, and full term at how many weeks? 37 weeks. And then the due date is at how many weeks? Oh, and not that we want babies born at 37 weeks, just if they are born at 37 weeks, they're usually going to be have enough weight on them. They'll be able to control their temperature. They'll be able to nurse really well. So 30, and 1 week can make a big difference. So 36 weeks, they might not have as much weight on them and they might not be able to control their temperature. So we don't really want 36 weeks. We want 37, but we want the baby to stay in, you know, we'll talk about that. But the due date is at 40 weeks, right? And then it is gestation is safe up to 42 weeks. What is that range? What's the time frame? So a baby is normal and healthy, or they can be born. The time frame of what we call full term is anywhere between 37 to 42 weeks. That's about 5 weeks, right? And I talk about this because the moms are anxious about when their baby is going to be born and they are fixed on the date that they were given. All right, 70% of women go past their due date, especially the first time moms. Only 3% of babies are born on the due date. I always say, "Oh my goodness, did you put any money on that date? Well, get your money out of that pool because they don't have a good chance of their baby being born on the due date that they were given." And in fact, I'll post a link to some information that I researched. If you go 5 days before the due date that they were given, and then 5 days after the due date, so you have about a 10-day range, you have exactly the same 3% chance of having your baby born on any of those days. So what does this mean about a due date? Mm-hmm. Yeah, so the due date is not very accurate. In fact, are you aware the due date system was created in the 1800s and it has not been updated since? Here is some update, but this is not new. This is not recent. In 1990, Middendorf found that factors such as your ethnicity, your age, or your height make gestation longer or shorter. And his work wasn't really complete because he only compared two ethnic groups, Caucasian women and African American women. But in those two groups, he found that actually Caucasian women have a longer gestational period, and then African American women had a shorter gestational period. And then what type of groups do you teach? I'm in California. We have very diverse groups. And so I say, and if you're not in any of those two groups, good luck. No, I'm just kidding. When is your baby going to be born? When? When it's done cooking. That's right. So if you go through your study modules, you'll find the Penny Simpkin information in her book, Pregnancy, Childbirth, and the Newborn. She has a chart that shows that labor is actually started when the baby reaches complete development. It secretes a hormone that is released and it interacts with the mother's hormones, and that starts the labor process. So I'm always thinking, well, if nothing is happening, might the baby be saying, I'm not completely developed, right? So a few other ways you can tell if a baby is what you call early, on time, or I don't like to use the word late, but was really comfortable in the womb. The babies are coated with vernix. So vernix starts to shed from the head down when the baby is ready to be born. And it keeps the baby's skin from drying out while they are in the womb for the 10-month period. Right? So a baby that's completely covered with vernix was probably a little bit early. Okay. And then babies that are right on time, you'll find a vernix lower. So maybe on their lower back and buttocks and just in the joints and crevices. And then sometimes babies don't have much vernix, right? So this baby doesn't have as much. Sometimes their skin is starting to crack and peel and their nails are really long and they're a little bit fat. And so that baby, you go, oh, you could have come a couple days sooner. But I want you to make sure you do your study modules and look at the research, because the evidence shows that it is okay for babies to, to take their time and to be born. And it's okay to go past that 40-week range with no adverse effect, as long as, they can do a non-stress test. And there are a lot of ways that they can check to make sure babies are doing okay. So one other thing to share, ripening is the term that we use for women when they're getting close to having their babies. Which banana do you like? I know this is strange, but I kind of like the one that's right in the middle, or the one next to it with the green tip still. And I'm sure you know which banana you like. And isn't that interesting? Just by looking at these bananas, we know the taste, we know the softness, we know if they are ripe and ready or not and need more time. And that is actually the same word that's used for when the cervix is ready. I want you to take your finger and touch the top of your nose. Touch it with your finger. Okay, touch the tip of your nose. Did you feel that? It's kind of hard and firm. Now, take the same finger and I want you to touch in the middle of your lips. Right? Touch the skin on your lips. And now I want you to take your finger and slide it a little bit forward. Don't go all the way into your mouth, but at the furthest part of your lip, right before you get into your mouth, and you'll see it's really soft and moist, right? And so that's the cervix, and I have my class do that. The cervix is hard and firm when it's not ripe, and then it'll soften, like, just like we just did. It'll be softer when it's ripe.